Hello, everybody. This is Susan Clinton, and welcome to Tough to Treat. Today, we're going to be talking about radicular pain and how it can be a complex situation and is usually treated from the perspective of the spine. But what about a persistent pain problem? In this episode, we discuss the exam and treatment of a gentleman with persistent radicular pain for over 10 years. You may be surprised by the real issues that drove him to seek treatment. Hello, everybody. This is Susan Clinton and my co-host, Erica Melo, and we are Tough to Treat. Hi, Erica.
I'm good. Hi, Susan. And yes, we are tough to treat. How are you? Good?
I'm good. It's been a busy fall. And we're back laying down our podcasts and looking forward to another season of some interesting talks about interesting people and interesting treatment ideas. And speaking of that, I have somebody that I've been working with that I am really going to be interested in a bit of your input on as we kind of talk through this a little bit. Are you ready?
I'm ready. Let's go for it.
Okay. So what I have today is a 73-year-old male who is, for everything that he has going on, is in tremendous shape. Just to give you a little bit about what he does every day, he and his wife ballroom dance, and he walks on the trail about 2.5 miles a day. And he also goes to the gym 3 times a week and does some strength training.
Wow.
So it sounds wonderful, right? This is a guy who's been dealing with chronic pain for 10 years.
Wow.
With pain down the back of his leg, mostly around the posterior pelvic area, but down the back of the leg into the thigh. Over the last 2 years, the pain has increased down into the side of the calf. And what drove him finally in was a friend of ours said, go see Susan, because he has stopped dancing because he is having numbness in his foot. And he feels like his balance isn't good, and he's really concerned about the numbness. And we'll get into that more in just a minute.
Susan, which leg is it? Right or left?
It's his left leg.
Left leg, okay.
Part of his history is he also has a genetic blood clotting disorder called factor V. And one of the side effects of all of that is a lot of joint stiffness and connective tissue stiffness and things like that. So he has a pretty rigid spine that has pretty much fused, and it is really straight. So he said he worked like a crazy person in his younger life when he knew what was going to happen and made himself, get straight. Almost like an ankylosing spondylitis is what it really looks like with him. But it's not. That's a different autoimmune. But, this one is more with the blood. And so, some stiffness of the knees, stiffness of the hips, the elbows, a little bit in the foot, ankle, and in the hands as well. But, he's kept himself as movable as possible, through the years. So he's been a champ when it's come to that kind of stuff.
When was he diagnosed with factor V? Was that just something years ago?
Years and years ago. And in fact, his daughter has it. So, that's kind of definitely genetic.
Yeah. Okay.
And so anyway, but how he got to me was, like I said, through a friend of a friend. PT said, he'd been to therapy several times before and never improved. And in fact, he always felt that it made him worse.
Oh, interesting. Okay.
He doesn't really appreciate modern day healthcare because he doesn't feel that he's been well served by it. Just his belief system, that nothing to argue about. It's just kind of who he is. So I kind of took the bull by the horns and decided maybe I better kind of talk to him about all the possibilities and figure out and really do a fairly decent neuro exam on him because I wanted just to be sure that there wasn't anything else going on. So we did all the vitals. We did blood pressure. I just thought, as long as you're in here, you might as well get, some things checked out.
Proper workup.
Yeah, it was, we were talking, And, so we did that. I did a sensory exam. I don't have monofilaments in my clinic, but, light touch was okay. and it wasn't really a problem. And what ended up happening as we were talking is the numbness is transient. So it's not just like now my foot is totally numb,
Yeah.
you know, and he was able to kind of show me how it goes down the, you know, the pain that goes down the side of his calf, and then it kind of drifts under and goes onto the ball of his feet. His toes were fine.
Okay.
You know, as far as that goes, capillary refill is good.
Yeah.
You know, his health markers are amazing. I mean, his blood pressure was really good. His heart rate is like 68. Just really very just healthy looking guy, even though he's just so super stiff.
I was going to ask you a quick question. Oh, are you going to get into the type of ballroom dancing he did, or was it just straight like waltz, rumba, anything in particular that aggravated?
We definitely are going to get into that.
Okay.
So one of the things that I noticed when he was sitting there was he would continue to cross his left leg over his right leg. And, you know, and he was fairly squirmy, you know, which makes sense. So I just asked him, you know, I said, are you having symptoms right now? And he said, I have symptoms all the time. Here we go, right?
Exactly. 24/7.
Yeah, 24/7. There's never a time. And I said, but you said the numbness kind of comes and goes.
Right.
And he says, yeah, kind of. Okay. So, you know, and he goes, I just, you know, bowl my way through, was his words, you know, and it's like, okay, I got it. So while you're sitting there with your leg crossed, are you having symptoms now? And he goes, yeah, I always have it in the back of my hip and down my leg, the under part of my leg. And so I just asked him, I said, well, what happens if you sit with your legs uncrossed? Does that improve it at all? And so he sat with his legs uncrossed, but still very close together. And I said, but does that change it? And he goes, no, not really. And so I just filed that in the back of my head because I knew what I was going to want to do with him, but I wanted to get some ideas from him first about his readiness to change. I should back up and say somebody in his family called to set his appointment for him and pay for it ahead of time. So like, this guy needed a buy-in. He needed to know why he needed to be there. So, which is unusual in my clinic because it's very consumer driven, but you know, okay, here we go. So I just asked him finally, I said, what do you really think is going on here? And this is what he said. He said, I have to tell you that I have a distrust for the medical profession because somebody convinced me to take a flu shot, and I did a flu shot, and then I coughed so hard I gave myself a hernia, and then I had to have the hernia repaired. And
oh my God.
Here we go, right? Here comes the story. And he goes, and everything that I've read about a numb cold foot means that I'm going to have an amputation.
Oh my God. Wow.
Wow, right?
Wow. I mean, wow.
So, and it was, I mean, I was impressed that he was going to tell me all of this.
Yeah.
You know, because these are some deep, dark, scary things. So, you know, I said, well, why do you think your foot is numb? And he said, I have no idea. I just know that this has started and it really, really is scaring the crap out of me. And he goes, and he said, you know, he goes, I can live without the balance. I can live with the pain, but I don't want to lose my leg. Like, okay. So we talked quite a bit about what I found. That's why I went in and did the full workup. So after it was, you know, after we did that, you know, neurologically, reflexes and everything were good. Like I said, everything, all of his health markers were really super good.
Pulses,
and I talked to him about, we did pulses. And I talked to him about the capillary refill. And we looked at that so he would understand that. So we really got a good lesson on circulatory and neurological kinds of things. I said, my suspicion is that your foot going numb is kind of an extension of kind of this sensitive nerve thing that's going on with you that you've had for 10 years. But let's test this out and see if we can actually begin to make this change a little bit, because if we can, then we know that, you know, this is, you know, probably that sensitive nerve. So let's see what we can figure out here. Quick go right ahead.
What did he tell you? I mean, he said he had pain all the time, but did he tell you certain positions or movements made him worse? Was there any one particular thing that he said?
No, pain all the time.
No, yeah, pain all the time, 24/7.
Yeah,
You know,
yeah.
no better, no better, no better.
In fact, it's getting worse because the foot's getting numb. So that's the party line there.
Got it.
And so a little bit more question, a little bit more doing. So that's why I wanted to I kind of approached it with him like, let's test the waters. We've already looked at this. We've calmed this down. You have good health markers, so you know that your blood flow is good there. Everything is good. And so I said, let's just test the waters on this and let's see what we can figure out. So what I did was I had him just stand up for me.
Mm-hmm.
And we just kind of got him in standing, and I said, tell me what's going on right now. And so he said, well, I've got some pain in my leg and my foot is starting to go numb now that we're standing up on it. It's like, okay, so let's see if we can find a different way to stand. So I asked him, I said, bring your feet closer together. And he said, okay. So he did. And he goes, that's actually making everything seem to be worse.
Yep.
And I said, oh, so it changes, right?
Mm-hmm.
So the pain is there, but it changes.
Mm-hmm.
And he would agree with that. Yes, I agree with that. And I said, okay, well, let's see if we can make it go down. So let's bring your feet apart.
Mm-hmm.
So he went back to his normal stance. I said, let's go a little bit further apart and let's just do that and see what happens. And when he stood with his feet further apart, the numbness in his foot went away.
Interesting.
So he said, that's actually making the numbness in my foot go away.
Good.
I said, that's great. I said,
and that was a wide base of support.
Not a huge wide, but definitely wider than his hips.
Mm-hmm. Yeah. Got it. Okay.
Which was very interesting.
Mm-hmm.
And so we did, some other movements. We did some bending over and finding some positions to bend in that didn't seem to increase his symptoms. And then I always followed with, let's see if we can do it and see if it actually gets better. So we kind of went back to the premise of, and I said, why don't you try bending over with that wider foot placement and see what happens? So he did. And he goes, actually, that didn't bother me. So that was good.
Yep.
And I said, let's see how we can apply this to some of the things that you're doing during your day. So for instance, I said, why don't you have a seat and show me kind of how you usually sit in your favorite chair at home. And so he sat back down and crossed his legs again.
Of course, yeah.
And I said, this is like your thing, right? And he goes, when I had more flexibility, I would cross my legs and kick my foot, bring his foot, intertwine it around his calf.
Underneath. Oh my gosh!
So he would cross twice. Yeah.
Wow. That's flexible for a 73-year-old.
Yeah. Right.
Yeah.
And he so. I said, well, what happens? So right now, and he said, my symptoms are coming back. And I said, okay, so let's do the same thing again. What do we need to do? What do you think we should do here? And he said, well, uncrossing my legs doesn't really make it any better. And I said, well, what if you put your legs wide apart?
Yep, in sitting.
Let's give that a try. It worked in standing. Let's give it a try.
Yep.
And he was like, that makes it feel better. In fact, my foot numbness is going away.
So in sitting and in standing, the wider base of support made him feel better.
Yep.
Or base of hip. Yeah. Okay.
Right.
That's pretty consistent.
So what's going out of my head now? Because I'll tell you, my original hypothesis was, you look at the age.
Yeah.
You hear about pain in the leg. It's been going on. It's getting worse, and you're thinking some sort of lateral stenosis.
Yep.
No,
not the case.
But not with him because it didn't get better with sitting.
Yep.
And it changed. So it's like, okay. Now I'm going, okay, so let's move that out of your head, Susan, because just because it looks like a duck and
I know,
quacks a little bit like a duck, it may not be that duck.
Exactly.
Let's figure out kind of what's happening here.
Mm-hmm.
So we talked a little bit at that point while he was sitting there with his legs further apart and feeling a little bit better. And I said, tell me what you do at the gym. So we started talking about the gym, and he said, one of the things that really bothers me is the leg press. And I said, I'm not going to tell him not to do something. This guy has got his routine. He's going to do it. And right now, remember, this visit is a buy-in visit. It's like, I wanted to give him some strategy so he could do his normal activities, but start to notice that he actually had the ability to change his symptoms.
Mm-hmm.
So I said, well, what if you get in a position like this on the leg press? And he goes, with my feet really wide apart? And I said, yeah, give it a whirl and see what happens. So we marked that down as kind of something that he could work on at the gym. And I said, do you do any standing exercises, like standing, doing the pull down bar, and, oh, yeah, I do this and I do this. And I said, so how do you think standing with a wider base of support would work for you with those particular kinds of activities at the gym? And he said, I'll give it a whirl. It's like, okay, good. So right there, we had some strategies, to start to change. So as we were kind of just thinking about some things, he said that he lays on his back and sleeps on his back every night. And this, I should have probably mentioned this. This guy has a pretty significant forward head. And mainly it's because his spine is like a bamboo spine. It is like stiff, straight up and down. Which, and he said that it just takes time when he lays down to kind of get that going, to where his head can actually come down. And
well, he has to
so he starts with a couple of pillows and ends up with one pillow as he kind of changes. So his stiffness is not ruling the day. He can change it. So he talked a little bit about how he lays on his back, and he thinks that that's probably one of the things that's making his pain worse, because when he lays on his back, he's putting pressure on the nerve because somebody told him once upon a time that he had a tight piriformis.
Oh my God.
This guy does not have a tight piriformis. He can cross his leg across midline. Right? He has pain with the movement, but it is not a muscle tightness problem.
Right. Or as Shirley would say, it's stiff but not short, or something.
Exactly. Exactly, right?
Yeah.
It can move. Anyway, so we talked a little bit about some positioning and changing some things around. But I said, do you wake up in the middle of the night? And he goes, no, I sleep 7 hours. And I said, great. I said, how do you feel when you wake up in the morning? He goes, I feel good until I get out of bed. And then I was like, so do you have symptoms in bed? Well, not when I not when I wake up in the morning. It's like, so the symptoms change when you lay down. It was like, well, yeah. And so then he was like, kind of like catching on here a little bit. And I said, I realize that you still have your symptoms. I'm not, questioning that. I said, but they do change. I just wanted to get if he could just grasp the idea that it could change.
And I think that and you could if he understands that it changes, he'll be more apt to, and he'll buy into it a lot easier, and he'll realize, oh, I actually don't have pain part of the day. Or
there are things I can do that changes my symptoms.
Correct. And just real quick, in like standing with a wider base of support, especially with people who've had persistent pain for so long, whatever position that makes them better, I always tell people, like you're doing, do it in a gym, incorporate it in your daily routine. You just, it's not just one exercise. You need to do it fairly frequently and fairly often to make permanent change for someone who's had pain for this long. Right?
Exactly.
So, which is what you did with the gym and everything. Yeah, that's cool.
So we talked about that. We did some stuff. His thorax is pretty stiff, so I'm not going to really change his T-spine a lot around all of that, natural fusing that happened, but we can still get the ribs moving a little bit better. So rolled up a small towel roll, put it long ways under his back to make him, just to give him some breathing and some stuff to do. And I said, this will feel really good. You can try this, do this. I was just giving him some things, so he had some stuff to walk out with. And his wife came with him, which was great. We had a lot of fun talking, and I got him to really see with some of the stuff he was doing that he could change it right away. And I said, okay, so the other thing that you like to do is you like to walk on the trail. And he said, yes, I do. And I said, okay, so let's get out of the room and let's go walk, and let's see what we can do. If we could change your walking to where you don't feel that numbness, because that was the most important thing for him. If he could be out of the pain too, great, but it was the numbness that was really his issue. And preventing him from doing the dancing. And I said, if you could walk on because he goes, my foot gets really numb when I walk on the trail, but I just bowl through. That's what he said. And I said, okay, well, let's see what we can do. Let's test out a few things. So I had him walk, and he was starting to tell me, he goes, yeah, and about now it starts to happen, and this and this. And I said, so what can you do to change that, to see if the numbness will change? So he kind of stood there for a little bit, and I said, just try it. And so he actually went wide on his own, which usually I have to cue them. All right, they need a cue or two, but he actually did it. And I said, I know this is going to feel weird. I totally understand that, but give it a go and see what happens. So he did, I said, and just kind of find the edge, like how far out do I need to go before it goes, for it to go away, and how much can I come in before it starts, and stay on the outside of that. And, so he did, and he goes, I don't have any foot symptoms at all doing this. And I said, okay. I said, are you willing to give this a try? Trail where you go walk?
Yeah.
And, he was, and I said, realizing that this is a short-term change for a long-term solution, it's not going to be all the time, but it'll at least keep you out on the trail, because I don't want you to not do things. I want you to do the things you want to do. But if it changes your symptoms, this is going to be in your favor.
Yes.
Because, it's going to take some time. I didn't even go into the whole brain and experience part with him, because it was just too much the first day.
Yeah, I mean, he
wasn't ready for that. He was just, he needed to see that he could actually change his symptoms by doing some different things. So he said, he goes, it'll slow me down. I probably won't be able to go 2.5 miles, but I'm willing to do it. It's like, okay.
Yeah,
cool.
if you let them do what they want to do, you just modify it. That's all. I mean, that's.
So then I asked him, his wife was, because we were out of the room at that point, and I said, so tell me about dancing. And he goes, just don't feel, my foot gets so numb, and I just don't feel like I have the control that I need, with the dancing stuff to continue the ballroom dancing. We still go once a week to dance, but my foot is really bad when we do it. And I said, okay. So his wife was there, and I said, do you mind joining us for a few minutes? And I said, I don't care which one you pick. They like to do West Coast swing, rumba, and foxtrot. Those are their three.
What's West Coast swing? Like a swing?
It is.
Like a swing where you go back and forth with the arms.
Well, it's a partner dance, it's got a particular step count to it. That's why they call it West Coast swing.
Okay.
So, there's different forms of these kinds of hustles and jitterbugs, and these.
There's a lot of rotation in these dances. Yeah.
So so I said, do whatever you want to do. So they got into hold, and I asked him then, I said, tell me about your foot. He said, it's bothering me. And I said, okay, what can you do to make it better? So he went a little bit wider. And I said, now remember, this is a short-term change for a long-term solution, but it'll keep you dancing.
Which
when you feel it, so she was fine with it. She's listening, to
and she would match his steps, like if he was giving himself a wide base of support as he was moving with her.
Yeah, wider. Yep. So wider, I said, just go ahead. I said, just do whatever you like to do. Pull out my phone, turn on music. Me, we're always having music and singing going on in my clinic. But anyway, and so they started to move, and I said, just when you feel that, remember to change it. And so he went just a teeny bit wider. He did these great rock steps and movement stuff and everything. And I said, how did that feel? And he goes, a little pain, but my foot felt okay. And I said, is this something you're willing to do? And his wife looked at him and she said, that's the best you've ever done that.
Aw.
And I was amazing. Like, thank you. Reinforcement. Woo!
I know. Practice makes permanent, as we say, right?
So that's what he went away with.
Okay. So basically wider base of support and incorporate that into his functional activities. Okay.
Yep. So that's what he went away with. That was his kind of go away message. I'll see you in a week. I just want you to go and kind of think about this and do this. And then I, of course, sent resources that had the links about pain and brain and some other things. And I kind of talked a little bit about why we decided to do this, just so we had all of that, in the written, in a written email.
So what do you think after the first visit? What was your working hypothesis about his diagnosis?
This is where I wanted your input just a little bit, because my working hypothesis in the very, very beginning, like I said, was probably some sort of lateral spinal stenosis that nerve just got irritated and has been sensitized for like 10 years. My hypothesis when he left was neural tension. And it's a sensitive, nerve trunk It's the whole trunk
Exactly. Exactly.
that is being pulled in. And I have seen this now so many times when people can't, they can't cross midline without those symptoms coming up, or they
Yeah.
can't
Yeah. Yeah.
they can't even bring their lower extremities closer together because it tends to fire things up.
I've seen that too. And then
Right?
when you abduct or just you have them move their legs wider, their symptoms go away. And I agree.
Right.
You think of the whole, the spinal cord and
Mm-hmm.
the whole nerve trunk. You're offloading something in there.
Yeah.
Because you're certainly not opening up the facet joints with those things. I mean, there's no way
No,
that
yeah.
could be happening.
Yeah,
So it's nothing
exactly.
like a mechanical at that point. I think because I could have a picture in my brain of this Brieg. I forgot the guy's name that he had that. Oh God, you see it in all the sort of neuro classes where they're offloading part of that dorsal horn or part of that nerve trunk by doing that. If I find the resource, I'll send it out to everybody on our email list. But I would agree with you. It's definitely nerve. Well, first of all, he has numbness, so that's something. Some nerve just isn't happy, right?
Right. And so to me, it felt like it was the entire trunk.
Yeah, I would agree.
This was involved at this point because he's getting more smudging, in his brain because it's spreading now and it's changing.
Yeah.
And, so this is, and it's not, and the issue, this is the first time he's had to back away from an activity because of something else going on. And of course that was driven by fear, as well, because he was afraid he was going to lose his foot because he didn't understand.
Right.
He had heard that a cold foot means that's it.
Totally. Yeah. Did you have him move one leg out at a time? I'm just thinking now if that would have even made any difference, or if it was just both legs together that you did to start.
I started off with just both legs together.
Yeah.
I was trying to keep it super simple.
Yeah.
And and I just was very curious to see if he went wide, how his symptoms would change. Because what I was seeing with him was holding himself so narrow all the time, and it wasn't feeling any better really.
Does he have a military background at all?
No military background.
Okay.
Nope. Just a great guy that's had smart guy and raised his kids and enjoys life. He's a very pleasant, nice, interesting fellow.
I was just thinking with
knows
the rigid
a lot about a lot of things.
hands.
Yeah. No, nothing. I think that's more of a. I'm just wondering if that's just more of the spine stuff.
Yeah.
Some of the stiffness that just kind of pulled him inward a little bit, perhaps.
Right. Of course.
I have no idea, but I mean, he's 73. He's got a lot of years of patterns and things that have come on, for him across the time. So, so he left and I sent him his stuff, and my thinking was where I needed to go with him was, okay, I need to start working on some neural tension stuff to help him, begin to get some length and mobility in that nerve. As you and I always talk about, the nerves need oxygen and blood, and
blood
they
suckers.
need mobility. Yeah, they need blood. Yeah, blood suckers. Exactly. They need mobility to keep going. And, for whatever reason, he got into trouble over there and it just got sensitized. It just did. So he's been I loved his words. I just bull on or bull through, both of those words he used all the time. And I thought, I'm going to be interested to see how he is next week, because he really has this pattern of bowling on, just going.
Yeah, because it's interesting because in both sitting and standing, two very different positions, the modification you made to his limbs made him better, whether he was loaded, unloaded, sitting, standing, and that in my opinion, when you see something like that that's consistent across many different postures or movement patterns, you have to think some neural tension or nerve trunk or something nerve related, numbness or no numbness.
Right.
The system is easing in some position, and it's like when you have more of the narrow base of support, you're tensioning part of that trunk. The system is letting go in that wider base of support where you're offloading, almost like the dural system. It makes them feel better because they're offloading one part of the cord.
Exactly. So he came back the next week.
Yep.
And I said, "How are you?" And he said, "Well, I'm the same." And it's like, okay.
Yeah, of course.
Yeah,
like
this was
24/7.
not unexpected. Yeah, not
Yeah.
unexpected. So we reviewed, and I said, have you tried doing some of the things that we did here to see if you could make your symptoms better?
Mm-hmm.
And he said, when I get on the leg press and I go wide with my feet, he goes, my pain goes completely away. And I said,
that's the same. Oh, wow. That's the same.
that's great. So I just started looking for his victories. I said, tell me what else.
Yep.
Well, I've been walking on the trail wider, so that feels better. Although I have to say that sometimes my foot goes numb, so I have to remember to go wider again.
Okay.
And it was like, okay, there's another victory, so I'm like writing these down, as he's telling me. It's like 1, 2, 3, 4, he said, when I sit in the chair, I notice if I sit like this, so if you can imagine, like frog leg position, like feet together, knees apart.
Oh my Lord.
And he said, when I put my feet up on the ottoman like this, I feel really good.
Of course. Yeah.
Okay, there goes another one, so I'm writing these down as we're going through. And then he said, and then I helped my wife with the towel roll I was using on my back, and her back pain got better. Okay, that's good. But he's unloading all his victories, so I'm taking every one of them.
Yeah.
And so I said, so what do you think the biggest issue is for you right now? And, he just kind of sat there and he thought about it. And he goes, I think I've just had this for such a long time. It's going to take time for it to change. And I said, that's true.
Bingo.
I'll go with you on that one. I said, but have you figured out ways to get your symptoms to lessen? And he said, yes. And I said, so where do you want to go now? Are you is this good for you, or do you want to press on? He goes, oh no. He goes, I have hope that this is actually going to get better now.
Wow.
I said, okay, let's do it. So what we did was we started doing the things that you talked about, when I saw him day one. I said, instead of taking both legs apart, what happens if you just step out with that left leg? Which is easily the same thing.
Yep.
But it just gave him another movement to do,
Yep.
and he liked that. We did some squatting.
Oh, interesting.
Which was fantastic, because we hadn't done that yet because we just didn't have time the time before. So we did a little bit more exploring some stuff. And one of the things that I found out is when he goes wide and then he bends over, he can relieve his pain.
Yeah. Yeah.
So it's like, okay, a wide bend over. So here we go. And I thought about you immediately, because it's like, here's this reset exercise.
Yep. Do it frequently. Yep.
Exactly. Whenever you start to feel that, do that.
Yep.
And remember that. So I did some hands-on work on the connective tissue of his leg, and some things like that, and he loved that. And we also did some neural tension moving, and some things. And I didn't go into anywhere where he was having symptoms. We stayed out, but I wanted him to explore that movement possibilities away from the narrow position, because as soon as we come in a little closer, it would start to bother him again. We did things like hip flexion, knee extension, coming down.
Yeah.
We did some
supine.
Yeah, basically supine. We did it in the chair too, so he would have choices, to do that. And then of course the bend over is a neural tension kind of thing with the wide, so I was into that, because it was like winding up his system but not giving him symptoms. So we did some of that stuff. But one of the things that I talked to him about, which I told him, I said, you've been pushing, I said, is this an accurate statement? Let me know, or we'll modify it to make it accurate. I said, here's your statement. I can just push through anything. It doesn't really matter if it hurts or what it is. I can push through anything. And he said, the only way I would change that is except for the numbness in my foot. I said, okay, fair enough. I can push through anything except the numbness in my foot.
Yep.
And he said, well, he goes, quite frankly, I've been pushing through that too, haven't I? And I said, well, you tell me. You're the one, it's your body. So I let him kind of sit with that a little bit. And I said, he said, so I guess that no pain, no gain thing doesn't really apply here. Or he said it doesn't really work. And I said, well, in this instance, no, this isn't going to be the way to go. And why? Because you have evidence that for 10 years it hasn't changed, and that's been kind of your modus operandus, right? And so he was like, okay, yeah, I can get that. And I said, so maybe what you need to do is, I said, not really take away that willpower and that push, but maybe channel it a different way. So maybe if you can channel that, I can push through anything. I said, then why don't you let yourself be intolerant of the symptoms to push yourself to change it. We kind of played around with that a little bit. What I wanted him to do, and we just needed to remember that he can really change his symptoms. And so what he got that first week was a little bit, but I wanted to really drive that, really reinforce that for him. So we spent a lot of time talking about that.
So just quickly, the slump and straight leg raise would generally all be negative in somebody like him, but you did, just for the listeners, that probably wouldn't have been positive test, but in terms of just getting neural mobility and oxygen and blood to the area, you were doing like hip flexion, knee extension, dorsiflexion, whatever, and sitting and supine,
moving the foot
so
up
they
and down,
understand.
Exploring. So I even take it just a little bit differently. So like I'll give them a strap to put around their thigh, and I'll have them kind of just work that foot up and down, the knee into extension and flexion just a little bit. And I'll have them actually explore it, like turn your leg in, turn your leg out a little bit, wave your foot back and forth in different directions, because
like ballroom dancing.
I'll go in all those different directions. So it's a little bit less boring than, just kind of dorsiflexion, extension, flexion, flexion, that kind of thing.
But the ballroom dancing is almost like his own neural glides,
Yeah.
Seriously.
So they still dance, but he says he finds it very, very challenging, though, to try to change his dancing. And I said, that's okay. Yeah. But I said, if your foot starts to go numb, that really is your cue to change. And, so he's processing that. That one is going to be a little tougher for him, but he's processing it and, working through it and thinking about it. And he says he's not ready to go back to lessons, but, they are still trying to dance once a week. And I said, that's fine. So just process it, do the best you can with it, because I'm not going to tell him not to go dance with his wife. That would be terrible. Yeah. He's picking it up and, applying this stuff in other parts of his life. He'll eventually get there too. And, so that's what he went away with the second time. So the third time that I've seen him, he definitely can change his symptoms. He really has better hope that he's going to get better. And, he says it's hard to remember not to just allow me to be in pain. So he's still struggling with that. Yeah, and I told him, I said, that pattern's been around for probably most of your life. Yep. You kind of grew up with the going gets tough, the tough get going, right? And, so he's like buying into the system now, which is really, really great. Yep. And so now we're starting to kind of work on giving him some more variance around the movement patterns and kind of testing the waters a little bit. I have to be a little bit careful, because if I tell him to go, if I ask him to bring his feet in a little closer, and he has symptoms, and I don't want to give him mixed messages. Right. I don't want him to get the message that now it's okay to feel the pain. It's like, if you can change your symptoms, then I want you to, anytime that you can do that, to do that. Right. So what we worked on the third visit was some strategies about getting in and out of the car. Yeah. Because he said, I can sit in the car and I can actually, open my thighs, to where it doesn't bother me as much. And that's okay. I said, because it's different, right? Yeah. You're looking for things that are different now, because you were only listening to the one thing before. Yeah. And he said, but I can't figure out how to get out of the car without really bringing my pain on and my foot numbness on. And that's fair, because he would have to bring him, so I said, where's your car?
Right, as a driver, right?
Out back, right? So I said, okay, let's go. Yep. Let's do it. Let's work on this. Yeah. And so one of the strategies he was doing was, as he goes to get out, is he tries to lift his knee up and bring his, but he's not bringing his leg into abduction, which was the weirdest thing. Huh. I just saw him, and he was, he kind of inches himself out as he turns around. And I said, what's bothering you here with this?
It's like his knees are stuck together. I mean, hello.
Like, what's bothering you here with this? And he said, I think I'm just, he goes, I don't know. He goes, I don't know. I don't have any idea. And I said, okay, back in. And all I want you to do is twist your trunk, which for him guess what he's
Yeah.
going to twist?
Yeah.
His hips, right?
His hips,
And I said, just twist your trunk and see what happens. I just was trying to figure out, is it the twist? What is it? What's going on here? Is it because he's so stiff in his spine that he can't figure out how to get everything out, you know, without the pain coming on, you know, or whatever. So he could, you know, so for whatever twisting he could do, it, of course it occurred at his hips. And I said, how does that feel? And he said, it doesn't feel as bad as when I was, you know, he goes, it doesn't feel great, but it doesn't feel terrible. It's like, okay. So what would happen if you didn't twist your trunk and you just picked your left foot out and put it outside of the car door, you know, out of the car? And he kind of looked at me like I was crazy, but whatever. I said, just humor me, give it a try. So he did. And I said, how does that feel? And he goes, actually, that's making my pain go away. And I said, why? And he looked at it, he goes, because it opened my, you know, it widened my, you know, my legs. It's like,
he's very consistent relieving.
Now try twisting. And then he could do it. You know, he could twist a little bit and then he could bring his other leg out. So it was just, you know, it was a matter of just busting that pattern up.
I know. You almost wonder with that straight spine, maybe he just was afraid to move his legs for so many years. And it just, you know, things happen and changes in the spine happen as you get older. And because of his diagnosis, it just happened quicker. And you know, insidious onset, but, you know, his left side was infected. And he just, when he opened those legs, it just offloaded everything and gave him ease of movement in the trunk. I mean, that's what it sounds like to me. I mean, I think that's fabulous. I mean, for, you know, I really do. And all those neural tension tests are good to do, but in somebody like that, as I said, they're just not going to be positive. But look at the history, right? You know, he is fairly active. He's, you know, he's got this genetic disorder. He's had the pain, for, you know, for so many years. If you have a patient like that, and, you know, with the view of our profession that he had, you need to just say, okay, let's try this, and think out of the box a bit. Spread your legs a little farther apart, and like you did, and if you can see the relief of symptoms, you're like, let me try other positions as well, and let's just go down that path instead of just doing a straight, you know, extension, side bending, you know, that type of thing. Forget the balance. Let's just get rid of the numbness, you know. This is, so how many times you've just seen him 3 times now?
I have seen him 3 times now.
Okay, so he can get out of the car better. He's dancing better. He's walking better. He's sitting better.
Dancing not so good yet. Dancing not so good. We've got some work to do.
But well, you're constrained by your partner. Can she move her legs farther?
Oh yeah, she's good. She can adapt to him.
Okay, is it one particular dance that bothers them, or is it just the?
It's when he has to cross midline. You know, because every dance requires you. So, like I told him, I said, you know, we're going to have to figure that one out. So I told him, I said, next time you come in, we'll work on some strategies around that. So my thing is going to be, how much can he cross midline before the numbness starts? So what he may have to do is have some strategies on scaling his dance activity. Like maybe he can do a dance, but then he needs to like not do the second and third one and then go and do the fourth one. You know what I'm saying? Like we would kind of scale an activity, maybe instead of trying to dance for an hour and a half, you know, or 2 hours straight, you're going to need some breaks in there.
I was going to say.
So let all that kind of calm down. So I'm going to have to kind of play with him with that, you know.
You know, I'm sorry, Susan, go ahead.
That's okay. No, go ahead.
Or do like the, you know, those reset exercises before and continue to do them throughout the day. You're good. And then every 20 minutes, do them in the class and see if you can dance longer without numbness. Just, you know, just break it up like you said. So that's going to be, and of course, working with him with some movement stuff, because I definitely don't want him wide for the rest of his life. You know, so we're challenging the movement over the wider base, and we're going to start kind of play, you know, I just need, right now, I just really, really wanted him to understand that he could change his symptoms. And once he's solid with that, then I feel more comfortable helping him come into more, you know, come in narrower a little bit, because he'll trust that he can
oh
nudge
wait,
it.
yeah,
Yeah.
that kind of like, no, I don't want to feel that. I want to feel this instead. And then, we're going to progress some of his movement things too, so that he has more to do to get that whole nerve trunk moving again.
So
So
do you think?
I actually even added today though, when he was kind of sitting in the chair, and then we got up and, we did it sitting in the chair. I had him raise his arms overhead and just kind of work on that a little bit. He stiffened his shoulders, but it's like, this is, go ahead. And he was, and I said, now we had him stand up, and, he did like one of his bend overs. And I said, now come up. And I said, do a squat. So he did. And I said, now, whichever hand you feel comfortable with, I want you to raise it as high as you can as you go down and do the squat. And I said, if you need to hold on to something, go ahead. So he kind of did it. He got to where he could actually do both hands going up as he went into the squat. And I thought, now we can really start getting that whole neural system kind of involved with him. And so some of the other things I think that is going to need to come in with him too, as how I always say, he needs some rotation, and we're not going to get it at the trunk. So it's going to have to be the head and the eyes. And he hasn't really rotated a lot there. And Erica, thank you for saying what you just said about him with his legs, because of the trunk and stuff being more narrow. And I think maybe probably the eyes and head position is driving that too.
Right.
So I think he'll be able to, maybe if I can get more rotation in, that's going to help
just go
do that twisting of that neural system a bit, so that he could actually be able to maybe start crossing over.
Yeah, it's like you could also have him, just go in the back door again with the head, and just, have his arms cross midline, just take arms cross midline, do things like that.
We can add that in with his walking.
Totally, and the head turning, and just try to go from where he has the mobility. That's what you need to use, and he could always, walk with that wider base of support with the arms, like you're doing, arms ahead, arms cross. He can juggle for all I care.
Yeah, exactly.
Turn his head,
which will ultimately help his balance again.
Yeah.
Yeah.
I mean, how can you have good balance when you have such a narrow base of support all the time, especially as you get older? I mean, I don't know. That's just my whatever. I mean, I think that he just probably didn't have. I think sometimes we develop habits because of what we're given with as a diagnosis, and that doesn't have to make us who we are as a person. You're not your diagnosis, you are a human being, and because you've got this diagnosis that makes you clotting and you're stiff, doesn't mean you can't move. He's evidence of the fact that he does move.
And wants to move and loves movement. I mean, he's still moving, and thank goodness that he is. It's just that, unfortunately the sensitive system there, with the pain experience he's having, just didn't respond to regular movement, and maybe needs a little bit more focused stuff to get it to get some changes in his brain to, not give him that pain experience as much anymore. So, he's starting to get the understanding that, that it might be a protective response. So that's good. So he's kind of getting that a little bit. I sent him the links, to the pain neuroscience guys, and he actually told me today, because I saw him today, and he goes, it's kind of like mindfulness.
It is.
I said, yeah, it is mindfulness. You have to be mindful that you don't want to feel that way.
And paying attention to what you're doing, and awareness, and
and he said powerful. He said he's pretty much, understands that there are times that when he's doing other things that it totally distracts him, and he's not paying attention to if it hurts or not. And I said, okay, that's good. Just when when you begin to feel symptoms, just be all in. That's your time. That's your call to change. And
changing his
keep
brain
going with that, because it's gonna, all of that's gonna happen, but it's it's gonna take a little bit of time, and he's okay with that. He's okay with it taking time. That's not the issue for him.
Yeah, but you made more progress with him in 3 visits than with all the other people combined. And I think that just shows the power of just using a little bit of imagination. Sometimes I know we're all not imagination, but think out of the box, and clinical expertise. I always talk about this. It's sometimes, you really have to think about it and look at the person's history, think about the person in front of you, not about the objective test you have to perform, because Teal will walk out the door, somebody like,
Yep. So,
just,
over the 3 visits, we got through most of the things, the PT things
exactly.
anyway. We just did it a different way.
Differently.
Like I said with him, just because of his distaste for the healthcare profession as a whole, that's why to me it was like, I got his permission, but I said, as long as you're here, let's look at a couple of things. But what I wanted to do was I really wanted to make sure, A, that everything looked good as far as I could tell, that he didn't need a referral out for something.
Right.
And, and B, that I could actually use that to help him understand, that maybe his greatest fear was something that he doesn't really, have. But, when you have somebody who has a clotting disorder and they hear about a cold foot, that they're going to freak out. And it's like that, you're good. And we, like I said, capillary refill and everything was really good. Nothing to give you any evidence of any kind of vascular stuff.
Yeah, I mean, numbness can be frightening. And I had an injury some years ago, and I had I think a neuropraxia, and my thigh was completely numb, and I'm like, that was freaking me out. I can deal with pain, but numbness, not cool. So you have to respect that feeling.
Yep.
Yeah, that is. Well, cool.
Okay.
This is awesome. I
thank you.
I agree with you 100%. Diagnosis, and I think the treatment's great. And somebody like this, you'll have fun with. You'll move and you'll cross midline. You'll turn your head. You can play balls. You can throw to him as he's walking. To get him to turn his head and use his arms. Yep. And then by the end of it, he wouldn't even know he had numbness in his feet, his foot.
Well, the rotation is going to be important because, especially for him returning to his ballroom dancing as well.
Yeah, very important.
Because they do enjoy it.
Yep.
I'd like for him to. He wants to continue that. He wants to return to his lessons. He wants to continue that, and that's important to him. So I want to get him there.
Yeah. No, what's important to him is what's important to you.
That's right. That's exactly right.
Yep. Cool. Well,
okay.
Thank you. Thank you, everybody.
You're welcome. Thanks for listening, everybody. Join our email list. Check out our website, www.toughtotreat.com. There's some opt-in measures there for the website.
Yep.
And we'll be having, we'll also be putting other things on the website as well.
Yep.
Things that we find interesting, as well as our YouTube channel. So
yes, also
keep in touch.
Yeah, also one other quick thing. I've gotten a lot of emails on the podcast that we did on running and pelvic pain, on the subtalar joint taping and mobilization that I did. I've gotten several, and I will video and the tape job that I did, and I will show a picture of the mobilization, and I'll figure out a way to put it up on the website as well, just because I get a lot of emails on that. So I probably wasn't clear enough in the podcast, so I have to video it. So anyway,
we'll promise that we can show all the techniques that we talk about, but we'll endeavor to show things that people seem to be interested in.
Exactly. This one I got
as much as we possibly can.
Yeah.
Yep.
Yeah. Cool. All right.
Okay. Thank you, everybody.
Thanks, everybody. Bye.